Hello dear doctors, today we'll discuss neurologic case about 70 years old male with tremor. And as always we start with our differentials, and the first one is gonna be Parkinson. Cerebellar tumor, and essential tremor. The common complaint in all of them is tremor. Which we copy and paste everywhere. And let's write a couple diagnostic studies for their beginning. And now let's fill our history. Now, time characteristic of chief complaint. Precipitating events. Right hand. Aggravated by fatigue, stress, alleviated, let's say no elevation factors. Stiffness in all body, feels, let's say like prisoner, they usually say that. Rates of falls. So it's important to ask patient, did he have any fall? Review of systems, weight, appetite, and also in cases of tremor you have to screen for thyroid disease, so you have to ask about changes in hair and skin. And heat intolerance, of course. Medications, no prescribed or over-the-counter. No allergies. And let's say that his family history is that he had cancer in his father. So in such cases it's important to ask about head tremors specifically. Surgeries or hospitalizations. So this patient is prone to falls. That's why it's important to ask about safety at home. And drinking coffee. Now let's go to our physical exam. There's no acute distress, but let's say that his appearance is significant for face change. Head and neck. Extraocular movements intact. Normocephalic or traumatic. And neurologic exam. Cranial nerves. Upper extremities. Bilaterally. And gait. So if you feel that you don't have time for checking gait, you can skip it, but it would be nice to include this part of physical exam. So patient can't repeat fine movements, rapid fine movements. It's called adiadochokinesia. And now let's feel support for our differentials. So we can take some findings from history and physical. write that there is no excessive cough intake. And also no change in hair or skin. Okay, and now findings from our physical exam. This one we can put everywhere. And what would be specific for cerebellar tumors, that our tremor is present with the movement also, which is not characteristic for Parkinson. Oops. Muscle rigidity. And shuffling gait goes here. And this one goes for tumor. And also for tumor, we have family history, or father died of brain cancer, and headaches. And for the last one, we leave the way it is, and let's add MRI. Differentials. That's it, the doctors. If you have any questions, please let me know.